So, today there is a general pharmacology formative assessment. Now, the purpose of the formative assessment is you have to just identify what are your strengths, what are your lacunae, which points are weak, and you have to work on that areas. Okay, so just achieving the marks should not be the goal of the formative assessment. Now, the rules of this exam: you have to select the correct option, but remember, more than one option may be correct. And if you find that no correct option is there, then write nil. You don't have to write the whole question. You just take a paper and a pen, note down your roll number, okay, and you just write question 1, answer is A, B, C, or if nothing is answered, then you write nil. There is a no negative marking, and for each correct answer you will get 1 mark. So total 20 questions and time is 20 minutes. So first question is, which of the following is or are characteristics of drug having high volume of distribution? Option A, high plasma protein binding. Option B, highly lipid soluble drugs. Option C, selective sequestration in the tissues. And option D, all of the above. Question 2. Which of the following is or are drugs produced through recombinant DNA technology? Option A, morphine. Option B, insulin. Option C, erythropoietin. Option D, liquid paraffin. Okay, you can go backwards later on, no issue. Question 3. In which of the following phase or phases of clinical trial primary purpose is to evaluate pharmacokinetic characteristics of drugs in human being? Option A, phase 1 clinical trial. Option B, phase 2 clinical trial. Option C, phase 3 clinical trial. And option D, phase 4 clinical trial. Question 4. Characteristic of essential drugs is or are. As I have told you, there may be more than one correct answer. For the treatment of the disease prevalent in the particular area, drug must be cost effective. Drug must be available in adequate quantity. Quality standards must be maintained. And last option, here there is another option, drug must be cheaper. Question 5. Science of identification of the drug is known as pharmacometrics, biopharmaceutics, pharmacognosy, and pharmacovigilance. Question 6. Limitation of oral route of drug administration is or are. There may be more than one correct answer. It cannot be effective in emergency. B. It cannot be effective when precise plasma concentration is required. C. Patient compliance is very poor. And D. It's a costly affair. Question 7. Which of the following routes should be preferred for administering drug for identification of drug allergy? Option A, topical application. Option B, intradermal route. Option C, transdermal drug delivery system. And option D, subcutaneous implant. Question 8. Advantages of sublingual route of drug administration are following, except, again here there may be more than one incorrect answer. Here you have to find the incorrect answer because the except word is mentioned. Rapid onset of action. Action can be terminated whenever required. Lipid insoluble drugs can be administered. And first pass metabolism can be bypassed. Question 9. Which of the most suitable method of intravenous administration where you want an immediate high plasma concentration? Bolus, injection, infusion, and you can use any of the above. Possibility or possibilities after biotransformation of a drug. Conversion to active metabolite, conversion to inactive metabolite, conversion to both active and inactive metabolite, and conversion of inactive drug to active drug. The next question 11. Therapeutic index is a measure of safety, efficacy, potency, suitability. The next, amount of drug required to produce desired action is known as safety, efficacy, potency, and none of the above. The next, fastest onset of action is observed with which of these following types of receptor mediated action? G protein coupled receptor, ion channel receptor, transmembrane enzyme linked receptor, and receptor regulating gene expression. Then which of the following characteristics of drugs is or are responsible for nil oral absorption of drug? No oral absorption of drug at all. Poorly lipid soluble drugs, strongly acidic drugs, poorly water soluble drugs, and drugs that are neither lipid soluble nor water soluble. Salbutamol is not effective for long-term management of bronchial asthma because of poor patient compliance, upregulation of receptor, downregulation of receptor, and tachyphylaxis. Most vulnerable period during pregnancy as far as the teratogenicity is concerned is initial 2 weeks. It means the period of the implantation, then 17 to 56 days, 3 to 6 months, and all of the above. Then question 17. In hypodermoclysis, large amount of the saline is administered in the pediatrics by which of the following route? Intravenous route, intramuscular route, subcutaneous route, and oral route. Maximum volume. Next question. Maximum volume of drug is administered by intradermal route, intramuscular route, intravenous route, and intra-articular route. Then question 19, you have to identify the type of the drug administration through this dosage form. You have to identify the drug delivery system. Okay. And the last question is identify the type of tablet. Okay. So these are the 20 questions. Best of luck.